Children. They are one of our country's most precious natural resources. Our hope for the future. Every 13 minutes in Wisconsin, a child is reported abused or neglected. Sadly, the number of children abused or neglected in Wisconsin annually will equal the population of Brookfield, Wausau, or Fond du Lac. We often hear about the strides that agencies are making to reduce the problem of child abuse in Wisconsin and our local communities. What we don't hear often enough is how organizations are helping child abuse victims and their families heal from the trauma of abuse and neglect and move forward with their lives. The Fox Valley Child Advocacy Center is charged with the very important job of providing services to victims of child abuse in a comfortable and friendly setting that is focused on the needs of the child. The Child Advocacy Center is one of several centers throughout Wisconsin that help children and their families begin to recover from abuse while providing community leadership and child advocacy.
The Child Advocacy Center, and as part of Children's Hospital Wisconsin Fox Valley's commitment is, we treat the child comes first, and the families come first too. So it may be following up with families, staying in contact, making referrals to other resources that are out there in the community.
Having the facility here means that the parents are locally, they can be in the waiting room to provide that support, just that encouragement sometimes that kids need. And so having it here locally has just been a real blessing in a sense for us to be able to provide a setting where this interview can take place in a comfortable setting.
The Child Advocacy Center is a unique partnership between Children's Hospital and Health System and several community partners. Physicians, nurses, social workers, forensic interviewers, police, family advocates, therapists, and educators work hand in hand to provide victims and their families with services in one location.
For families, when they get over just the trauma that their child may have been a victim of a crime, in the past we'd have to say, okay, now we need you to come down to the police department and do an interview there. The social worker may need to also meet with your child at some point to find out what services they need to provide. Then if we think there's injuries, well, now we got to bring you to an emergency room or have you make an appointment with your family doctor. To be able to cut that down and become more efficient for families, I don't think we can put a price on the value of that for our kids in the community.
Every child who's brought to the Child Advocacy Center is offered a complete medical screening and assessment conducted by experts in the medical, nursing, and social work fields.
A lot of the parents want to know if it's a report of sexual abuse or physical abuse, are there injuries? Is my child okay? Is their health okay? And so having that questions answered, and usually can answer that the same day they come for the visit, gives a great sense of relief. They're not having to wait to get those answers or wait to get into the doctor to make an appointment to see the doctor and then hear what the results may be.
The role of the Child Advocacy Center is a very important one here for our investigations. Investigations of child abuse or sexual exploitation of children are very tricky investigations because a lot of times you're not going to have physical evidence and you're going to have basically the word of an adult against the word of a child.
Another critical component of the Child Advocacy Center is the forensic interview. A skilled social worker talks with suspected abuse victims about their experiences in a child-friendly setting. This interview is taped and is part of the child abuse investigation. Forensic interviews are provided to the court so that children may only have to speak about the abuse one time.
A forensic interview is conducted. These interviews are beyond what the normal interview is. They're done by professionals that have a manner of establishing rapport with these young victims, and they put it together comprehensively. They understand the elements of the offense, what law enforcement's looking for to get enough of a foundation built that would substantiate criminal charges. So we use the CAC for putting together these very in-depth and very articulate interviews of these children.
The judge can watch the video. Even if the case doesn't go to trial, the judge can still watch the video and hear from that young child what the child went through without us having to put the child through the trauma of actually coming in. One big piece of this is the fact that more of our cases, and the majority of our cases, are settling when we have those videos of the interviews of the children. So we're avoiding to bring the child in, put them through the trauma. Really, the family is just as easily traumatized and nervous and anxious when you go through any kind of court proceeding. So the center has helped alleviate a lot of those stresses, as well as helped strengthen our prosecution.
Experience has shown that the team-centered approach at the center improves the treatment and investigative process while providing better service to the child abuse victims and their families.
Having one place for everybody to come together with is a great importance with the investigation. It makes it much easier on the social worker involved, law enforcement involved, the families involved, and many times we get advocates from either Reach Counseling that help with victims of sexual abuse or the Christine Ann Center, and we can all come here together and collaborate our efforts as to how the investigation is going to go from here on in.
The Child Advocacy Center's emphasis on collaboration and its unique delivery of services has proven to be the most cost-effective method of treating abused and neglected children. A study conducted by the National Children's Advocacy Center in partnership with National Children's Alliance has shown that the team approach to service delivery costs nearly 36% less than traditional treatment and investigation methods. The results are rewarding.
What we know from personal experience, from professional experience, and from the very best of the experts is that children need an environment that they can express themselves, because again, they are the most vulnerable of all the victims. They have the greatest difficulty expressing themselves, they have the lowest ability to understand what's happening to them, and so we have to give them an environment that's going to allow them to tell their story in a way that it's going to be heard by the public, it's going to be heard by a jury, and they're going to understand exactly what happened and be able to do the right thing.
Giving children a voice, providing guidance and support through the healing process, breaking down the barriers to helpful services. This is a story worth telling. Children's Hospital and Health System's Child Advocacy Centers, making a difference in the lives of thousands of Wisconsin children and families each year.